Hello friends, I am presenting a case of retained products of consumption which was disturbing to a 34-year-old woman with one living child as a 4-year-old kid, history of MTP pills taken 1 month back, and she complains sudden onset of PV bleeding. On examination there was cervical os was closed and bleeding was present through cervix. Ultrasound revealed an hyper-echoic mass of 5 into 3 centimeter. When we put a Doppler, we could see there was a minimal amount of vascularity from the posterior wall of the uterus. According to Gutenberg classification, a minimal amount of vascularity within the endometrial cavity is category 1. When the vascularity is up to the endometrium, then it is 2. If it is to the myometrium, then it is 3. A classification of retained products of conception. In our case, we could see the vascularity was seen only in the minimal vascularity seen and more towards the posterior wall of the uterus, which confirmed it is a retained product of conception, and it was not evacuated by medical, completely evacuated by medical method. So planned her for a diagnostic hysteroscopy to find out why it is not being evacuated by medical method in spite of trying it for 2 times, since there was history of empty pills taken 1 month back. After that, she was trying to have evacuate the contents by medical methods 2 times, but still patient was having incomplete and persistent repeated amounts of bleeding PV. Hysteroscopy shows that there is a retained products of conceptions are present in the uterine cavity. We could see both the tubal ostia separately, and we are seeing the products of conception is attached more towards the posterior wall of the uterus. This we are trying to figure it out from where it is arising. So there we can see only in the posterior wall it is well attached. Otherwise, we could see all around the anterior wall and lateral wall of the uterus were free. Only it was attached mainly to the posterior wall in a broad base. Now we introduced a resectoscope with a loop, and it is not connected to the electricity. As post abortion and post delivery curettage will lead to Asherman syndrome, and this we are expecting a little more resistant, so we try to scoop it out through the resectoscope. Because it was a little larger in size, we try to suck it out by suction and evacuation. After suction and evacuation, when we re-inspected the uterine cavity, the major products had reduced, but still significant amount of products of conception is still is well adhered, and it is not coming out even after suction and evacuation. So with the resectoscope loop, we are trying to dislodge it from the uterine wall, and later we can take it out using the ohm forceps. So what we are doing is just trying to dislodge all the adherent products of conception. Since we are using little higher pressure of the intrauterine pressure, it was nearly 200. So while separating, we are not finding any amount of bleeding because of the intrauterine pressure kept little high. So we can see that we are completely trying to separate it all around, and it is quite broad based where it is significantly attached, and it has adhered only in the posterior wall. As I told in the beginning, we could see the attachment of the products of conception more towards the posterior wall. So in the same wall, we are trying to dislodge it from the resectoscope with minimal damage to the endometrium. And the loop is not active. It is means electricity is not connected to it. It is just a cold loop. We are just trying to dislodge it. Once we found out that all the products of conceptions are dislodged, then we try to evacuate it using the ohm forceps. So most of the part has been dislodged. Only on the right, only the lateral walls are seen have a adhered products of conception. Otherwise, most of the part have been dislodged. So hysteroscopy is one of the good way to take out all the retained products of conception, especially if they are resistant to evacuate by medical method and the patient is having a repeated amount episodes of bleeding PV. So now we can see that almost all the products have been dislodged. Once all the products are removed, now we are planning to reconfirm. After removing all the products of conception, we have to do the check examination. So this is the final view after removing all the products of conception, and after once we dislodged, the products would easily come out after removing a resectoscope, or some products were removed using the ohm forceps. Now the whole uterine cavity is empty and clear, and later we plan to give a carbitocin injection to reduce the chance of bleeding later. All the products have been expelled out. Now the uterine cavity is empty. So this is the one of the best way. If the adherent retained products of conceptions are present, which does not evacuate easily by routine method. So if there are any doubts about this retained products of conception, please comment. So these are the products that were seen after evacuation.